Especially with the clamshell exercise, details is going to be where should my hip angle be when I'm going into the exercise. So if we have our typical clamshell exercise kind of coming up and down like so, we can change our hip angle anywhere from like full flexion to full extension. And our major consideration in this is where do we feel it, is when we go through our clamshell maneuver, do we feel it more like in the IT band, do we feel it more in the backside hip, do we feel more adductor, do we feel more hamstring pulling, or do we actually see like a posterior pelvic rocking? So the kind of correct answer to the question for our starting position can be depending on the shape of your hip socket and kind of how well you're activating. We can either start like further down or even go like a little bit of extension if we can still feel it. If we can't get that, we're just getting compensation. Sometimes it pays to go a little bit higher up into like a 90-degree flexion ankle, or a little bit more into a little bit more of like a centrated hip position. So when I get through here, sometimes if I raise this up a little bit, I'll feel some of the other tension cut down, and then I have to use a little bit more posterior glute. If we have some tightness or hip restrictions, whether it's arthritic, capsular, or myofascial, sometimes you can get that higher down, especially some impingement issues if you have to clear it up with some manual therapy. So occasionally we have to kind of like budget, go in between, and kind of like what arc is it going to be, 90, 60, 45, 75, like what angle are we going to get the best contraction? Now over time we want to be able to decrease this angle. We want to be able to get the hips more into extension, and then eventually get lower straight leg also. So we get as much of an adduction and turn rotation load into it, starting high, and walking our way down to make sure we can feel it through the entire range of motion. But in the beginning, we just have to kind of play with it and see what we got. So priorities would be, we want to make sure we just don't feel too many of the compensated areas. We're trying to target backside hip, primarily posterior glute type stuff. So whatever angle we need to begin with, typically we want to start like around like 90-ish, more centrated to get going, and then drop into extension. But depending if we have some impingement issues, some other stuff, we might have to fudge out a little bit. So in other words, play with it a little bit, see which one works out best for you. Remember that's more that centrated hip position as far as the higher flexion angles, kind of clearing into that external rotation drive. And please look at some of our others. We have some other things with either the band push or some of the hand prompts, some more of the supporting function tricks to try and get some more out of it. So, have some problems with clamshell, play with the angle a little bit, see what you got, and have a great day.